This week, a UK study estimated that 700,000 people die annually from infections by drug-resistant pathogens. By 2050, such deaths will rise to 10 million. Antimicrobial resistance is a ticking time bomb and a huge global health issue. Antimicrobial resistance, also known as drug resistance, occurs when a pathogen that used to be susceptible to a therapeutic agent mutates in a way that makes the medicine ineffective. So there is a difference between antibiotic resistance and antimicrobial resistance. Antibiotic resistance occurs when bacteria change in response to the use of antibiotics used to treat such bacterial infections such as urinary tract infections, pneumonia, bloodstream infections, and these antibiotics become ineffective. Antimicrobial resistance is a broader term, and it encompasses resistance to drugs that treat infections caused by other microbes, such as parasites, so malaria or helminths, which are worms, viruses such as COVID and HIV, and fungi such as Candida. And so we call these the superbugs. Why is antibiotic resistance a global concern? Well, it's happening right now. The impact is unknown because there's no system in place to track antibiotic resistance globally, and it's a deadly threat. Without urgent actions, many of the modern medicines could become obsolete, turning even common infections like UTIs and pneumonia into deadly threats. So what accelerates the emergence and spread of antimicrobial resistance? Overprescribing of antibiotics, patients not taking antibiotics as prescribed, unnecessary antibiotics used in agriculture, poor infection control in hospitals and clinics, poor hygiene and sanitation practices, and lack of rapid laboratory tests to diagnose specific infections. And so the misuse and overuse of antibiotics, if someone has a mild bacterial infection and takes antibiotics for only a few days rather than finishing the entire prescription, or maybe if a person skips a few doses, that person will have killed off the susceptible, weaker bacteria, but the harder bacteria still will survive. And biologists call this selection. And so the remaining bacteria may have developed a resistance to the misused medication, which means it will be harder for that person to fight off infection with common antibiotics. Even worse, that person could spread this hardier strain to other people for whom the common first-line antibiotics will not work at all. Did you know that more than 80% of antibiotics go into animal feed, making it the major contributor to antibiotic resistance globally? Experts say that regulatory caps, reduction in global meat consumption, user fees to cut animal antibiotics are some of the suggestions and upstream approaches to decreasing antimicrobial resistance. Stop taking antibiotics for viral infections such as the common cold. The reason being is that the individual taking the medications is not being helped by the antibiotic, but instead is killing off the body's helpful bacteria and allowing potentially harmful bacteria that are already in the body to proliferate or grow and spread. These stronger bacteria may develop drug resistance, necessitating that the infected person take yet another antibiotic. It's a global problem. Inappropriate access to and use of medications in one nation can rapidly cause a global antimicrobial resistance problem. A new superbug that evolves anywhere in the world can pose a threat to the whole world, and we've seen that with COVID. Let's talk about healthcare-associated infections. These are also called hospital-acquired infections or nosocomial infections. These are things such as central line-associated bloodstream infections, catheter-associated UTIs, surgical site infections, ventilator-associated pneumonia. And some healthcare-associated infections are drug-resistant. What can nurses do to prevent HAIs? Well, we know good hand washing, use of personal protective equipment, minimizing the use of invasive medical devices. How can we prevent AMR? Well, we can start by preventing the infections, start making sure that any of the procedures that we do as nurses, inserting catheters or inserting IVs, that they're done under sterile technique. So preventing infections so no one has to use antibiotics. Expanding the use of diagnostic tests to ensure that appropriate antibiotics are prescribed. Reducing the overuse of antibiotics to treat diseases in human and livestock. And developing new antibiotics. Nurses have a key role in tackling antimicrobial resistance. You could be involved in your antibiotic or your antimicrobial stewardship program. Avoid requesting antibiotics for treatment of viral or fungal infections in your own personal and family care. Ensuring patients are up to date on vaccinations and educating patients on antibiotics if you're discharging them from hospital. We have a key role in tackling antimicrobial resistance. Ensure healthy eating to avoid exposure to antibiotics in the food chain. Refrain from disposing of unused antibiotics into the environment. And always use hand hygiene and other infection control practices to decrease the risk of spread of HIAs. We will move on to our next lecture looking at the role of nurses in communicable diseases. And this is one huge role for nurses, is looking at their role in antimicrobial resistance.